Today marks World Suicide Prevention Day, which aims to honor those lost to suicide and those still struggling, as well as to raise awareness around the globe that suicide can be prevented. Clinical psychologist Thabo Lephoto joins us now for more. Thabo, good evening. Thank you so much for your time. Really do appreciate it. Just about 1 in every 4 phone calls made out to the South African Depression and Anxiety Group helpline is a suicide alert phone call. Those are people on the other side of the line saying, I am pleading for help. I am dealing with suicidality. In this moment, I'm considering taking my life. Please help me. And given that we know that this is becoming more and more prevalent in very specific demographics, there's still very little that's being done actively in getting preventative care out there. And a lot of the conversations we have about suicide, depression, and anxiety seem to be reactive rather than proactive. How do we turn the tide?
It's going to take a lot before we can actually turn the tide. The biggest issue that we have in our society is stigma. There is still lack of information that is passed out. I believe there's not a lot of people that know about helplines such as SADC. I believe there's not a lot of people that even know what mental illness is. So for that to change, there has to be a lot of information that is put out there. And I think that, media bodies and schools and other entities need to start stepping up, the way in which they serve or even give out information that is related to mental illness. The bestest ways that we can break stigma is if we start conversations about mental illness mental health related illnesses. So that is the bestest way that we can start changing the tide.
Yeah, but one must acknowledge the fact that mental health care is incredibly inaccessible in South Africa for a number of reasons. One, there's just not enough social workers, there's not enough psychologists, and there's certainly not enough psychiatrists on the one hand. But secondly, and importantly, is that even amongst the psychologists, psychiatrists that we do have, the cost to access one is just extraordinarily bad, right? If you're lucky and fortunate enough to get on a waiting list at a public hospital, you might wait for a long time before you really get to see one. How do we fill the resource gap?
It's a very good question. And I think that we need to start asking such questions to the government. How are they, bulking up the resources? How are they making sure that hospitals have enough psychologists, hospitals have enough psychiatrists, especially from even, the primary level where, access to psychologists is easily found in clinics. It's a question that I think we need to start engaging our government in finding out what are they doing in order to make sure that our people are getting the necessary help from even the primary level.
Yeah, and more importantly, when we talk about having the conversation around removing stigma, particularly when we sit on days like World Suicide Prevention Day, Mental Health Awareness Month in South Africa, which typically is celebrated in October, or commemorated rather in October, how do we begin to have those conversations without making people feel alienated, without making people feel less than, without making people feel like there's something fundamentally wrong with them? How do we broaden and make the conversation open and accessible?
Let me make an example. Let's just say at home you have someone, a loved one, whom you've seen their behavior has changed. They are no longer the same. They are more quiet, they're more withdrawn. There are those crying spells that they may have, whether you hear them in their room or you see it happening. The bestest ways is for us to unburden that feeling of I am alone. And how we start that is to actually say, I'm here for you. I love you. I'm here to support you. You are not alone. as we start using such terms and such phrases, we are making it easier for them to also open up to us. But more especially, I think us as the community or the society, we also need to not be ignorant to what has been happening, because these people are our family members, and we've seen them suffering. We know of cases where people have died from suicide, right, or from committing suicide. We know that that's how their death came about. So we need to start asking or going online. Searching what is suicide, how can I help a loved one. I think that we are blessed with an abundance of information, and we are blessed with an abundance of this AI that can actually help us. We need to start exploring and engaging in such technologies to also be able to help our loved ones. That is the business ways that we can go about it. But the more information that we have regarding mental health, the better it is, or the better equipped we will be in being able to help our loved ones.
Yeah. Thabo, thank you so much for your time. Thank you so much for your insights, and thank you so much for your work. Really do appreciate it.
Thank you for having me.
Yeah, Thabo Lephoto is a clinical psychologist and a senior counselor for the South African Depression and Anxiety Group.